Well, hi everyone. My name is Ellie Dahlman, and thank you so much for joining us for this 1-hour webinar event. We will review how to align administrative and program costs for county contracts. And we just want to remind you that you will be muted for the duration of the presentation. And we will also have time for questions at the end of the presentation. So feel free to submit your questions through the Q&A button. You should see that icon usually at the bottom of the screen. You can also press the raise hand button to ask a question verbally at that time too. But today you'll hear from a number of county staff who all have just introduced themselves now, Robert and then Jazz.
So I'm Robert Mankia. I'm the Chief Financial Officer for the county.
Hello, I'm Jazz Andar, the County Procurement Manager.
And Mary and then Brad.
Good afternoon. I'm Mary Trainer. I am the Procurement and Contract Services Manager at the Human Services Agency.
And
hello,
Janet.
everyone.
Oh, sorry, go ahead.
Hello, everyone. I'm Brad Johnson, Management Analyst for BHRS Contracts.
And then Janet and then Yvonne.
I'm Janet Gard. I'm the Deputy Director for Administration and Finance for Behavioral Health and Recovery Services.
Great. So those are all the folks that we'll have on the call today. And just to remind everyone that this presentation is being recorded. So we'll be able to post this along with the slides following the event.
Can Yvonne introduce herself?
Did you want me to introduce one?
Yes.
No worries. Hi, I'm Yvonne Collings. I'm with HSA as well, Human Services Agency.
So welcome everybody. I think what we had in mind is really a short presentation today because we really want to focus on trying to answer some questions at the end. And the idea behind this is to just try and give some ideas. We are not here to tell you exactly how to do things. We're not here to try and, make it so that we're giving legal advice at this point in time. But we have been at this for a while. And as we do a lot of contracting or a lot of work with the federal government and the state government to try and make things work. And we, as you, have to get things to fit in to our bucket. So we have some things that we try and do. And what we're going to do is have that kind of conversation with you so that you can see how we do it. Just like you guys divide costs, we all divide costs as well. So we try and have to manage things in an interesting way. I also wanted to state you may not hear from everybody today during the presentation, but we are all here to try and answer questions, which is why we have the room that we have. We do want to be able to get to people's questions the best of our ability, which is why we have invited others to join in. So we're going to review some federal and state guidelines. We're going to try and define administrative costs versus program costs and kind of really look at those. We're going to really talk through the importance of the funding source itself. And then we're going to actually do a little scenario where we're going to look at a budget on how it came in a little bit high on the admin side. And then after some conversation and some really diligent work on our end, it was able to be devised into what was needed to get to the rate that we had to fit within. And then we're going to have questions and answers. So next slide. So one of the things that we felt was really important for everyone to understand is that there is actual law out there. It is now called the Super Circular, but there is actual law at the federal government that binds us to how and what our allowable federal expenditures are inside of many of our claims. And although different dependent on the funding source, one of the things that many of the funding sources point back to is this OMB CFR that you see here in regards to indirect costs. So one of the things that is really important is that section that's highlighted is that 10% of the modified total direct cost. That is what they allow for the administration of these programs. Now, it's not just, interestingly enough, it's not just the CBOs that are responsible to meet this, it's also the county. So we have the same kind of structure internally to be able to meet some of these cost rates and how it is devised in that function. Next slide. The other part that I believe is really important to understand is the federal funding. So here, what we're doing is we're giving you an example of some funding sources. Both of these are federal. When you look at the cost cap, both of these are federal funding sources, or all of these are federal funding sources. And as you can see, each of them have an idea of where certain things are at. So for all the titles, the Title 4E, which is most of your children and family services functions, Title 20, which has a lot to do with Medicare that sits outside of short, doyle, and other functions. Title 19, which is also Medicare, that sits outside of the Social Security Act bucket. All of those funding mechanisms have a 10% indirect cost cap. And that is a cap. So when the state, when the counties, when different entities push money or send claims to the federal government, they come in and they say that, you need to meet this 10% indirect cost cap across the board. But then you have these other federal things that are called block grants and TANF. So for us in the state of California, one of the biggest ones is CalWORKS. CalWORKS is a TANF block grant. So we take TANF money in from the federal government, or the state does, and then they divide that out amongst all of the different counties and programs that meet that TANF requirement, and they get a block of money. And in that block of money, they can only spend to the block. So what the federal government says is that basically in here, we're not going to give you the same cap. We're going to allow you to be able to use the cap a bit differently. And that is how you end up with these different mechanisms that we're all trying to fit in to try and make all of these funding sources work when it comes to this administrative cap. So then I'm going to go ahead and turn it over to Jazz to talk about some of the state guidelines.
Okay, so I'll discuss a little bit on state guidelines. I'll talk a little bit about both how the state establishes their own admin rates with the feds, as well as how the rate San Mateo County is required to use when contracting out state dollars is established. So for state agencies, they're required to submit cost plans to the feds based on information that they include in their plan. They're given the admin rate required to be used in their contracts. For dollars state agencies are granting to non-federal entities, in this case being us, the county, the feds have given the state the authority to review and approve rates, and that rate given to us by the state to the county is required to be used in any contracts we execute with CBOs or any other contractors. And then moving along to the definition of direct versus indirect costs. So indirect costs is an agency-wide expense that's not directly linked to the scope of work or deliverables in your contract. It's usually admin services for general operation of your organization, and we have some examples listed on the slide for you. I think what's important to keep in mind is that it should be an estimated proportionate share of indirect costs charged across all of your contracts. Direct costs are associated with contracts, scope of work activities, and support the activities that are in your scope of work. So basically any cost that is directly required to achieve the service in your scope of work. And then I have an example on the next slide. So here the example is that your agency estimated human resource services is $10,000 and you have 10 contracts. What we've seen is that a lot of agencies are charging that $10,000 across all of their contracts, but what you should be doing is allocating amongst the 10 contracts based on the direct costs and then the service that's provided in the specific contracts.
So Ellie, I'd like to stop here for a minute and see if there are any questions, because this one area here where we talk about the federal guidance, what the actual definitions are in these different administrative handbooks that we have, these are the areas that are really important for people to really grasp the idea of what this definition is and kind of how these things are looked at. So are there any questions out there that people would like to ask?
And just as a reminder, you can raise your hand using the icon at the bottom of your screen, or you can submit through the Q&A icon. And I don't see any hands raised, although actually here are a couple. Bjorn Remo, you can unmute yourself.
Hi, yes, I'm Bjorn, and I work for Star Vista. Hello?
Great. Yeah.
Hello.
Hi, I just wanted to find out exactly what the contract scope and award amount means in terms of, proportionally allocating the indirect cost.
Okay, so the contract scope is usually Exhibit A or Attachment A of your contract, and it lists out the activities and deliverables that you need to perform in order to provide the service, whatever service that you're providing to the public, to the county. That is the scope and the activities that you're performing. And then the award amount is your total contract amount, whatever you've been awarded from the county as your total contract amount. So that would be Exhibit B or Attachment B.
Gotcha. So, okay. So, but it's based, let's say the contract scope that's actually based on, let's say Star Vista, where they propose, some kind of contract to SMC to do some BHRS work, and the county determines the allowable indirect costs based on the award amount and the contract scope for that contract.
Well, I think that's all dependent on the funding source. So if the funding source is from the state usually gives us an indirect cost rate that needs to be used. If it's from the federal government, they usually give us an indirect cost rate that needs to be used that we in turn give to CBOs and contractors as their cap.
Got it. And so this is the reason for just the variances on, because we have multiple contracts with the County of San Mateo. And again, as you mentioned, depending on the contract scope and the amount of awarded, we have different indirect costs for each contract. So is that correct?
Can be. I think that I think it's really dependent on one, the funding source. So if it was a titled source, then it might have a different direct cost rate. But the actual percentage is based in some cases on what you may turn in. So you may have devised different strategies internally. So it's hard to answer exactly why without the contracts in front of us. Janet and Brad, do you say the same thing since this was directly to behavioral health?
Yeah, I would go back to the funding source being the major role in this, but yeah, we'd have to look at it.
Got it. Thank you.
Next question is from Jolie.
Can you hear me?
Yes.
Yes.
Yeah, so typically we don't allocate based on contracts. We allocate based on usage of staff. And so I'm looking at this. I mean, many of the organizations have multiple contracts, of course, but they also have lots of areas.
Oh,
We lost her.
Jolie. I apologize.
What happened? Can you hear me now?
Yes.
Yes. We
Continue.
lost you.
You guys are just
Sorry about that.
thought you were just cutting me off.
No, that was a mistake.
That's okay. That's okay. What I was saying is that many organizations do not allocate, functional costs based on the number of contracts they have. I mean, so in this example, it's sort of odd, but I just want to clarify what your point is that the cost for human resources services in your organization should be proportionally allocated to the utilization of whatever contract you have, not based on the amount of contracts you have.
Yeah, no. So when I say based on the contract scope and or award amount, it is how much staff you're putting into that in order to accomplish that scope. So
Correct.
exactly what you said.
Right. So you could allocate a portion of your human services costs or whatever else admin or indirect costs that you have based on utilization and the contract scope, not the number of contracts, because that can
No,
be.
I was just giving the example that you should allocate to all of your contracts. So if you're performing a scope in all of your contracts, you should be allocating throughout, because sometimes some CBOs and contractors that I've seen in the past will allocate to just one or will allocate $10,000 to all of them without understanding that the proportion amount is very important.
Right. I think you have to have a rational basis, whatever that may be, to that scope and contract, correct?
Yeah. Mhm.
Correct.
Okay.
And I think what Jolie just said is a very good and valid point. The idea here is not I have 10 contracts and 10 contracts are treated equally. It's I have 10 contracts that have 15 staff, and those staff are within those contracts at different rates or at different percentages of time, let's say.
Yeah.
There may be a more larger base in one contract than another. And it's important that you use some methodology to determine how you are going to devise your administrative costs. And the other part is that gets treated equally or consistently amongst all your contracts. So if you're dividing,
Sometimes though, that's very difficult because, you know, there's some contracts that will allow nothing. And so when you're looking at proportionality and, you know, if they don't allow anything in your contracts, there's a discrepancy there. So I think when we do it, we have a very good rationale and are consistent with that rationale amongst all of our contracts. But that's sort of, you know, looking back, that's what makes it so difficult. And I was just clarifying this example that was, in case anybody else was questioning that, it's not, it just appears that you wanted us to allocate amongst 10 contracts. So thank you for the clarification.
other questions?
And yes, Erica Horn. You should, there you go.
I just wanted. Okay, am I unmuted?
Sorry. Yes, I apologize.
Okay, no
I
worries.
don't know what's going.
I just have two questions. And that is, one is the, so is the word contract replaceable? Because for us, you know, our contracts make up only like 50% of our budget. And then we have funding from other sources, individual, whatever, donor, so forth. So are we factoring that into the equation that you're showing here as well? Or is it just related to contracts? And then the second question is, I heard the word staff and then I'm seeing human resources. I just want to clarify. So the human resource services, are you talking about the administrative costs related to having human services, or I mean, having humans employed? Or is this the staff, like staff costs are considered part of this? Because I thought staff costs were program direct, but is it actually indirect for staff?
No, so maybe I should have used something else as an example. For this example, the human resources services is just the human resources that you have in your agency in order to just run as an admin cost as an organization.
Gotcha.
And the staff is more so the staff that is supporting the scope to achieve the service that you're trying to provide.
Gotcha. Okay.
I don't see any other hands raised, but we did get a few questions in the Q&A. There's one question asking if are FTE a cost driver that helps with allocation?
It can be. Again, it's dependent on the organization's decision on how they're going to derive costs or how they're going to drive costs to individual departments. It could be different in some instances, which is why I say it that way.
And then we have another question. The exception to the 10% limit on indirects for CBOs is if they have an approved indirect plan, correct? And is there guidance on what an approved indirect plan looks like and who it has to be approved by?
At this point in time, my understanding is the idea of, and the way this is being described here, is that the idea of indirect are all of those costs that are associated to not direct to program function. That's how we're describing indirect here. An indirect cost plan is a document that is approved. At this point in time, my understanding, and I'd have to go back and really look, is that in the county, we do not have anybody doing an indirect cost plan at this point that we allow a percentage for. We need the backup documentation for our reporting purposes to the federal government. So although you are telling us that your admin or that the admin 10% cap limit is at 10%, you're looking at those costs across your administrative functions things that are not direct to program, and you're saying that those things are going to be weighed in some way, and that is how I am going to come up with my indirect cost to my contract. So a contract would have two sets of costs. It would have direct costs and indirect costs. That's the purpose of this discussion.
Great. I don't see any other raised hands. Let's see.
I see a question. Give us a good basic example. We're going to give you one in a little bit, right at the end of the presentation. So I think we're good to go forward, and we'll get back to questions in a minute.
Great.
Okay,
So I think
hi
we're
again.
good with Mary. There
Ready?
you go.
Okay. Just a reminder, I'm Mary from the Human Services Agency. And I have kind of a brief message, and that's basically that when we're writing our contracts, we are looking at the funding source. So any limits that we put in the contracts, and when approved budgets go into the contracts, we're going back to what that funding source dictates. And we do have contracts that are funded by a lot of different sources, so that can depend, and we're always going back to that. Although many of you will have experienced that 10% administrative cap, because that does apply to many of our contracts. I'll hand it over to Brad.
Okay, hello again, Brad Johnson, contract management analyst. So for BHRS, the administrative caps also vary. For Medi-Cal, short Doyle funded services, full direct services are reported, but there is a 15% administrative cap. Again, the funding sources have different administrative caps, usually from 10 to 15%. It all is dependent on the funding source. We can go to the next slide. And we're going to take you through a budget scenario here that hopefully Mary and I can help you out with. In the budget scenario, if we want to go to that one, we have an example of total funding at the top here of $1,061,000. Okay. Under that, you'll see the direct and operating expenses with a total of $964,000. Under that, you have the administrative expenses, which includes rent, utilities, and salaries, totaling $250,000. All right. So adding those two together, that's the direct operating expense and administrative expenses, we come to a total of $1.2 million. All right. And this is over the total amount funded of $150,000 by $150,000. So obviously that won't work. So we need to do something. So I'm going to let Mary take it from here to give us some examples of what we can do.
Sure. Okay, so now we can go to the after slide. And just to reiterate, this is an example with sort of simple numbers that to sort of illustrate what we're talking about. Okay, so we identified that what we have in an administrative bucket is too much for the overall target that we're hitting. So we wanted to look at what are making up those administrative expenses, and are we putting in the legwork upfront to make sure that we've allocated those properly. So in this case, we can look at it and see that actually some of those salaries that we said were admin are supporting direct activities that are directly related to the scope of the contract. As Jazz mentioned before, that's going to be in your Exhibit A, and that's the services that you're performing. So those could get moved. We can look and see that actually, although when we do the math, the portion of utilities that might go here was previously $25,000. We can actually say that $5,000 of those are for a site that is used exclusively for these program activities. And we can do the same for rent. So by moving some of that, we were able to get that, that admin expense at the target. Again, these are just sort of sample numbers, so it's not about the math totally making sense. But the idea that we're looking really carefully at what we're putting in what bucket, and are we truly utilizing our program expenses the best way we can.
Now that might mean that you have to actually lower what some of the personnel expenses would have been in the first round, right? So when you initially put this together, you had stated that you were going to put this amount of money into those personnel expenses, and you find that you can't get to that number because you need to be able to push your administrative expenses or move the administrative expenses in. The idea here is to be able to focus things so that you were able to achieve the true costs of what it is that you need to get paid for the services that you're providing. And the idea that if you find that rental is direct to program because it is occupying a direct space that is going to be used for these clients all the time, that can be a direct to program expense. And we're not saying that we're going to be able to give you more money. In many instances, we only have a dollar amount that we're working with. And we have to work within that dollar amount. The idea here is that we are willing to work with organizations to make sure that we can hopefully get you to a point where we're having some kind of conversation in regards to getting some of these administrative, what would normally be considered administrative expenses, locked into some of your programs so that the program cost goes up and the admin cost stays at the level that we need it to stay at. So next slide. So here, what we're really looking at is really looking at the idea of how we can take these two ideas of program costs and admin costs and try and use different strategies to be able to get the result that is still needed for both your organization and for what the county is asking for in regards to the service component. We wish that there was more dollars all the time to be able to have and put out there, but in many cases there's not. There's a limited sum of money that we are able to utilize for some of these programs. And the idea is that we do want to make sure that we are able to give you the money that is associated with those administrations. I heard earlier someone mentioning that that they may have some other drivers or contracts are only a small portion of what they have with the county for their organization. You know, one of the things about that I even found difficult in one of the county departments when we were trying to devise cost is many of your funders at the same time don't want to be paying for the administrative side of the house either. So interestingly enough, we find that it's not only the money that we're getting from the outside or from the Fed or the state, but in many cases, sometimes even our donors or the people that are putting money into our programs also want to make sure that their money is going to the service component rather than the administration. That tends to make it difficult for all of us because administration is a need that everybody has and it's not going to go away. It's the idea of trying to find ways of making sure that you are being paid for the costs that are associated with what you need to as a entity to survive. And I think that's what we're trying to put here. Again, we're not giving you accounting advice. We're not giving you legal advice. We're just trying to have a conversation or show you some possible ways of moving things around to be able to get to where you may need to get. And some of you already do this. This isn't new for some of you at all. You guys have been doing this for a very long time. This right here is, you know, more of an example for those organizations that are really starting up or having trouble or haven't seen this and don't completely understand it. It's simple, but it does take some time to have the conversations and really truly understand where things are at. So I kind of want to make sure that I restated those things so that we were all aware of where we're going. Next slide.
All right, so before we jump into question and answer following that section of the presentation, I just wanted to remind you all that you can find recordings and slides from our past trainings on the San Mateo County procurement website that's listed here at the bottom of the slide. And we also plan to post this recording and the slides on this page, so that should be up in a week or two. And future training events will also be posted here as well.
Okay, so
Ellie,
Uh-huh.
Ellie, this is Janet. Can I make one quick comment? For those of you who contract with BHRS and you contract through short doyle programs, I just want to make one quick correction. The 15% administrative cap is on BHRS. It's not on the contractors. I just wanted to make that clarification.
Okay, so questions?
All righty, let's see here. I see Colin Laver. You should be able to unmute yourself.
Thank you. Can you hear me?
Yes.
So I just had clarification, and going back to that example, is the whole point of that example to show that oftentimes what is called an administrative cost is actually can be re-termed a program cost? Is that what you guys were trying to illustrate in that example?
Yes.
Okay, and thank you. And I just want to say that I really dislike the term administrative cost because I think it confuses people in thinking that somehow their administrative workforce is an indirect cost. Sometimes that can be very much a direct cost. And I wish that we could get rid of the term administrative. What we know as nonprofits is we have direct cost and indirect cost across every cost center in our organization, and sometimes you know, those can be directly attributable to a direct program cost. I'm just making a case for getting rid of that word administrative because it at least confuses me in thinking that somehow my admin staff is always going to be indirect. I don't agree with that. I think that administrative staff can be directly apportioned to programs sometimes.
I understand. I wish I could remove it. It's actually a term of use in many different things that we have to abide by. So that's why the term is there. But I understand your point, and it really is an indirect cost. You are correct in that aspect.
All right. I see we had a question come in asking about the 15%. I think this might have been in regards to what Janet mentioned. The question is, so does that mean CBOs cannot charge 15% for admin?
No, it means that CBOs don't have to, CBOs for BHRS short doyle don't have to worry about these direct and indirect cost allocation. But that's only based on short doyle funding. We have other sources that have caps.
You know, when Janet mentions that, one of the things that comes to mind is this idea that you really have to understand these funding sources. We were having a discussion earlier with CBOs at a luncheon, and you know, one of the main things is really understanding your federal sources, or what funding source is part of the money that you're receiving, because understanding what that funding source allows really helps determine how you can then utilize your money or your dollars to better align with what they're requesting. So I think that's one of the main things, and I stated it there and I'll state it here. We will find some possible trainings that we can acquire, because I do not believe that, although we have many county staff that understand the federal fundings, I would rather have somebody actually come in and give us a training that has that background, so that we're not stating things that they don't want stated. So we will be looking for trainings in regards to that here in the future. And then twice now, I see the idea that will we be posting this? I've seen that twice. Yes, we'll be posting this online to that website that Ellie showed. a few minutes ago.
All right, and I see one more hand raised. Bjorn Remo, you should be able to unmute yourself.
Oh, thank you. Thanks, Ali. So just wanted to clarify a couple of things. HSA is 10% indirect cap and BHRS 15% indirect cap as well.
No, BHRS, the 15% cap for BHRS is only on BHRS. It is not on the contractors.
Got it. Thank you. And then my second question is there a link to the funding source? Because it seems like that's the driver on how to determine the indirect cost.
So every funding source has its own legislative background and information. There are a bunch of links once you know what the funding source is that you can go to and kind of read a lot of language. The legislative language is not the easiest to go through and has a lot of gray that then you would have to go to the Office of the Inspector General, which sits in the Treasury, that then usually has an FAQ against how they are determining those funding sources to be allocable. So there's a lot of different parts and pieces to that, but you can find them. If you knew what the funding source was, you can go online and see what that is. And in many cases in your contract, you should know what some of those funding sources are, because it's a reason for, we have to claim it in our single audit. So when we do our single audit at the end of the year, anybody that we've given money to from one of those federal programs, because that's a federal audit, has to be mentioned inside of that audit, and the contracts have to be pushed against it. So we should be putting those things inside of those contracts, or those funding sources in the contract.
Got it. I think you're talking about the program codes, right, Robert? Sorry.
I'm not talking about program codes. I'm actually talking about the funding source. Some of them do have program codes that come along with them, especially for HSA. And that's because they're coded within the book that they have for their claiming function. And the only reason why I know that is because I used to be there.
Okay.
I think it's a little different for behavioral health services. And then Janet made mention that, they have a 15% administrative cap in short doyle that they are responsible for, but they are not holding that to their contractors at this point in time. And it is only for short doyle. So I don't want to confuse that it's for other funding as well, because I think there's other funding that comes in for them that is a bit different and has different caps associated to it.
Got it. All right. Well, thank you. Thanks, Robert. And thanks, Ellie, for letting me ask my questions. Thank you.
Sure. Thank you. Jolie, you should be able to unmute yourself.
Thanks. I just wanted to make one comment too, just for the group, is that, as Robert says, it really does depend on that funding source, because sometimes there may be a 10% cap that comes from the state or wherever, but then the county will take 3% and we get 7% or 2%. So I think every contract and every agreement is different, and it's really difficult. And I can understand how difficult it is to explain that. It's not the same. Whereas the state or feds may allow X%, there's always a shared piece as well. So it just depends. That's been our experience. Is that?
I think that's very accurate. Again, it's all dependent on what has to happen within the source itself. So, I think we were given, so I'm thinking about the federal money that just came down for ERA associated to COVID, which is the rental program that we have kind of given and turned over to the state. To turn it over to the state, we were only allowed to keep 1.5%, and we have to put all the information into the federal system. So you are 100% correct. It's across the board. So the state is taking it for the admin of their program or what they decided to do, and we are being given a very small dollar with the reporting structure on our end. They said you need to fit within this. But because it's serving people, again, we're going to figure out how it works. And I think that happens on both sides, on the CPO side and on our side, to try and make it so that we're getting the work to the people. I wish there was a time, or I hope that there is a time that people begin to understand that we can, to serve people is not just straight. I've always had the explanation of, a dollar to the federal government by the time it gets to a city or a CBO or even a county is literally somewhere in the neighborhood of 40 cents. And I'm using that as an example. Don't quote that, please. It's a true statement, because all of these things, even to push the money out from the state and do all the financing behind their end, the reporting that they have to the federal government, the reporting of the federal government that they have to the other sites, all of those things have to come into consideration, and all of those things take money off the top. And I think, that is always a difficult piece. And I see that Jolie has actually said in the thing that private funders seem to be understanding more about the core mission, and that overhead and accounting and fundraising is all part of that. So that's great to hear. I have not seen it completely on my end yet, but it's great to hear that that's beginning to come something out there, because I think that that's an important part to get everybody to understand.
Thank you.
All right. Thank you. Let's see, any other questions that folks have? You can raise your hand or submit through the Q&A function. All right, if not, I don't know, Robert, were there any closing thoughts that you wanted to share, or any other of the panelists?
Any of the other panelists? So again, what we're trying to do is create communication to try and make sure that we're getting information out there to the best of our ability to the CBOs and others. We have a forum through, I believe, the CBO leadership group and through Thrive that we're trying to keep intact. We're really trying to make our relationships better in any way possible that we can. We're trying to get the information out, dispel some of the myths, I hope, and really try and help understand where we all are at. And at the same time, just create a better working relationship with all of you. We're really striving for it, and we're trying. So we will then, continue to do little tiny trainings. If you guys come up with something, we'll look at some federal stuff that we may be able to do. But again, you can always ask, and I've asked this of almost all the contractors or the contract people that we have in the county, whether it be Brad or Mary or Janet or Yvonne or Jazz. They all have an understanding of what's going on and really are willing to communicate and ask questions. So please utilize those to get your questions asked. And then again, my office is always here at CMO, so we are always willing to help wherever we can. So please contact us if need be.